Welcome back, students. This is Modular 9, Mental Health, Substance Abuse, and Developmental Disabilities. We are starting video 2 of 4 in terms of the lecture. And so we'll go ahead and proceed. And where we left off last time is having a conversation about why do people develop mental health problems. And we did talk in the previous video. We talked a little bit about um, heredity and genetics, and that a person who has a parent who is has mental health issues may be more inclined to have mental health issues, so that there's some indication that it could be hereditary. And that also we know that there can be chemical imbalances in the brain that may result in people experiencing mental health issues. So moving on with those two things in mind, another consideration might be the psychosocial developmental factors. This really goes to Erickson's theory about the fact that mental health problems result from environmental experiences during childhood. Think about when we learn how to deal with other people in the world and experiences in the world. When does that happen? Well, that happens in childhood. The lessons that you learn and the way that you learn how to interact with people and how to handle issues in your life are often stemmed from what was your interaction with people when you were a child and an adolescent. And so, if those experiences were negative or dysfunctional on any level, that may be the way that you are prone to then deal with those issues as an adult. And that's where we're taking a look at this concept of psychosocial developmental factors. Social learning. Mental health problems are the result of behaviors that are learned. So, again, as a child, what were you taught? If you were taught that it's okay to be rude to other people, or it's okay to use physical violence as a way of being able to resolve issues, and from your standpoint, that's normal, you almost maybe operate from a place where you think, well, isn't that how everybody deals with anger or combating particular issues. And then you get out in the world and you find out, no, not everybody. In fact, very few people really deal with emotions and feelings using physical violence as a way of resolving them. You're going to find yourself to be outside of the norm, and that will then potentially result in issues around mental health. Social stress. There is an unbalanced relationship between a person's environment and their ability to manage that stress. So think about the comforts that you have, the things that you use when you're stressed out, whether it's food or TV or reading or whatever. All of those things can be comforting and help you manage your stress. But if it gets to the point where you're now using food in an unhealthy way to try to manage your stress, then that can then become problematic. People use a variety of different kinds of things to manage their stress. People use sex. People use shopping. People use drugs and alcohol. So those are all things that, in the long run, may prove to be more problematic than you want. And so then it's about trying to find other mechanisms of being able to manage your stress that have less of an impact on your health or well-being. And then finally, societal reactions and labeling. People who do not adhere to social norms may be considered mentally ill. So, the person who chooses to, um, live as a homeless person, maybe by choice, may be considered outside of the norm. There are certain people that are very prone to wanting to live a very isolated life. That they're going to be maybe the individual who finds a piece of property way up in the mountains, someplace where nobody's ever going to really know that they're there, and that's what makes them comfortable and the sort of life that they want to lead. So, not that they're necessarily mentally ill, but sometimes making those kinds of choices results in people perceiving them as being not normal, as we might say. Um, so, in treatment, social workers look at behaviors and symptoms and the extent to which they disrupt an individual's ability to operate within the world. Like we said earlier, we've all got things that we deal with in unique and different ways, and some of them are have relatively small effect on our lives, and but others may have more substantial effect. So I think whenever you're looking at whether there is a behavioral or symptomatology that's occurring relative to a mental health issue, and you ask, is it something that needs to be addressed or not necessarily need to be addressed? Some of the things that you're looking at is this getting in the way of a person being able to make a living? Are they not able to go to work anymore because of this particular behavior or symptom? Are they not able to continue in school? Are they a parent, and are they experiencing challenges in terms of caring for their children? Is their relationship with their partner in life, their husband, their wife, is that becoming a relationship that's at risk because of these behaviors or symptoms? Are they spending money that they don't have? Are they, making poor choices in terms of food or alcohol or drugs? Those would all be the kinds of things that you would be taking a look at to see whether there is a legitimate need for some type of an intervention. The environment a person exists in can exacerbate the problem of mental health for an individual. The person's environment can also facilitate an individual's ability to cope more effectively with their mental illness. For a person who's living in a chaotic or stressful environment, maybe their housing is not secure. Maybe they're having to relocate quite frequently, over a series of several months. Maybe they live in a neighborhood where there's a lot of violence. Maybe they are living in a maybe they're living outside of a country, maybe they're living in another country where there are significant social or political problems going on. Um, Maybe there's never a sense of security about making sure that there's going to be enough food in the house, or that the heater is going to work, or you're going to have running water. Those are all stressors that will contribute to a person who's maybe at risk already for experiencing a mental health issue, that will then, to a certain extent, push them over the edge. So a person's environment plays a big role in terms of how a person manages their mental health problems. On the opposite side, if you're in a nurturing environment, it's a secure environment, you feel loved, you feel cared for, um, you can focus on what you're trying to resolve relative to your mental health issue. There, you've got now an environment that facilitates your ability to cope more effectively. Cultural assumptions and understandings can play a role. How does one's community or family view or accept an individual's mental illness certainly can play a big role. So if it's acceptable or it's acknowledged that somebody in your family is a little bit different than everybody else, somebody in your neighborhood is a little bit different than everybody else, but they're not shamed or stigmatized or isolated. They're accepted, and everyone grows to try to understand what's unique about that person. Then you're talking about a culture that's really supportive and working to try to make sure that individual has everything that they need to be able to um, successfully thrive. So we're going to get into some specifics now about the types of mental health problems that people often experience. There's a whole variety of different types of mental health problems. The most common types of mental disorders are major depression, bipolar disorder, schizophrenia, anxiety disorder, attention deficit hyperactivity disorder, and autism. And we're going to now take a look at each of these individually. So major depression. This is more than just feeling a little blue because it's Monday or because maybe you didn't get a school assignment done quite the way you wanted to. This is really quite often over a long period of time, leaving the person fairly dysfunctional, not being able to do the things that normally they would have been able to do. It's the leading cause of disability worldwide. Individuals incapacitated for weeks or months. 10% of the US population, 18 or older, has experienced major depression. It's an overwhelming feeling of incapacitation. I'm just not able to do anything at all. 50% more women than men experience major depression. 80% of patients respond positively to treatment. So again, if there's an effort or a mechanism of being able to get a person into treatment, they often can experience an improvement in the symptoms and be more successful in their lives. Bipolar disorder. According to the National Association of Mental Illness, about 2.3 million residents in the United States experience bipolar disorder. It's characterized by mood cycles alternating between depression and mania. So it's a period of time of feeling very depressed and very sad and very blue and very incapacitated that's followed then by a huge swing in terms of perception and behavior of feeling that you're on top of the world, that you could do anything. You don't need to sleep. You don't need to eat. You want to take on new things. You want to go do things that maybe you normally have not been interested in doing. You just feel on top of the world. You feel like you could do anything, which is not, when actually evaluated, is not something that a normal person should be feeling. When I talk about on top of the world, I'm saying on top of the world, just I feel like I could go, climb Mount Everest and fly a plane and do 100 different things that I have no business doing. Abnormal and persistent elevated mood or irritability. During their mania period, they may be quite irritable and sort of easily kicked off. Can be treated with meds and a holistic approach. Schizophrenia. So this is a condition where more than 2 million adults in the US have experienced schizophrenia annually. Most chronic and disabling of all of the mental health disorders, according to the National Association of Mental Illness. Thought to be a chemical disorder, impaired ability to manage emotions, interacts with others and thinks clearly, experiences hallucinations, delusions, disorderly thinking, and social withdrawal. Schizophrenics are emotionally sort of all over the map. Happy to sad in a moment's notice. Quite, to be honest with you, self-absorbed. There's a lot of sort of like me. They can interact with others and think clearly, and then immediately become sort of experiencing hallucinations and delusions. Very common for very disorderly thinking. And all of that, I think, results in this concept of social withdrawal. So behaviorally and emotionally, just 0 to 90 miles an hour in 10 minutes. Just wide changes. Not like bipolar disorder, where a person experiences several weeks maybe of being depressed that then transitions into a mania phase. This is really from moment to moment, happy, sad, angry, feeling all sorts of emotions, and really not being able to quite of explain or understand where those changes in emotions are coming from. Anxiety disorder. The National Institutes for Mental Health reports more than 40 million adults in the US experience some form of anxiety disorder. So you can see that number is quite high compared to the other conditions that we're taking a look at. These would include everything from panic disorders, obsessive compulsive disorders, post traumatic stress disorders, phobias, and generalized anxiety disorders. More common in women may be due to chemical imbalance, emotional trauma, or learned response, treatable with medication and therapy. So I'm sure a lot of these are things that you've seen before or heard about before. Obsessive compulsive disorder is sort of that hand washing thing that you hear about. It's not only about hand washing, but I mean, that's one of the ones that you're most aware of, somebody who feels that they need to wash their hands 20 times a day. Um, Post traumatic stress disorder, we're going to talk a little bit more about that later on in the modular. Generalized anxiety disorder. This really goes to what, we all have probably experienced at one time or another, going in for a job interview and being, anxious, going in to take an exam and being anxious, walking into any new situation that results in you feeling sort of butterflies in your stomach and a little panicky and those kinds of things. That would be what would be considered a generalized anxiety disorder. The challenge comes, and this is a good way of thinking about this, is if your anxiety gets so high that you choose to not to go to class that day to avoid having to take that exam, now we're talking about something that's problematic. If you are so anxious about that job interview that you don't go on the interview and therefore obviously don't get the job, now we're talking about something that's resulting in some dysfunction. And so that's where you're talking about the difference between people who, are just a little bit nervous or not feeling comfortable about a certain situation, but proceeds anyway and is able to walk into that classroom or walk into that job interview, as opposed to those who chose not to make those efforts, and it impacts their lives in that particular way. Attention deficit hyperactivity disorder. This is a mental disorder of the neurodevelopmental type, characterized by problems regarding paying attention, excessive activity, or difficulty controlling behavior, which is not appropriate for a person's age. These symptoms can begin at age 6 to 12, are present for more than 6 months, and cause problems in at least 2 settings. So when you're talking about being able to diagnose attention deficit hyperactivity disorder, there is a time frame for when it usually is going to happen between the ages of 6 and 12. It has to go on for at least 6 months for it to be something that could be diagnosed. And it has to cause problems in at least 2 settings. So maybe problems at school and problems at home. Autism is a neurodevelopmental disorder characterized by impaired social interaction, verbal and nonverbal communication, and restricted and repetitive behavior. Parents usually notice signs in the first 2 years of their child's life. We've heard more about autism over the last several years than we did previously. It's becoming more and more something that parents are dealing with in terms of their children. Again, it's this kind of affect. What I hear people say is that, there's a sense that the child isn't able to express sadness or happiness. They are not able to interact with others in their family or in their world. There's often issues around certain noises that can be very irritating for them. It's very, very important that they have consistency, that they know what to expect. So if oatmeal is what you have every morning for breakfast at 8:05, it can be quite disruptive for a person with autism to be presented with bacon and eggs at 8:30. So, I mean, that's a really simple way of thinking about it, but they really do crave consistency and sort of routine. That's where they feel secure and safe. So that's where we see that restricted and repetitive behaviors. These signs often develop gradually. Thought that some children with autism reach their developmental milestones at a normal pace and then regress. The diagnostic criteria requires that symptoms become apparent in early childhood, typically before age 3. So there's some very, very strict criteria in terms of diagnosing autism. Suicide. And this is the 10th leading cause of death in the US. It's the third leading cause of death for young adults between the ages of 15 and 24, and for children between the ages of 10 and 14. There's a strong relationship between suicide and substance abuse and or mental illness. 90% of suicides have some type of mental illness or substance abuse disorder linked back to it. Risk factors for suicidal attempt include depression, alcohol abuse, cocaine use, and separation or divorce. It's interesting that the highest rate for suicide in the US are white men over the age of 75. Men are 4 times as likely as women to commit suicide. Suicide in children and youth is increasing significantly, and it's quite prevalent in the gay, lesbian, bisexual, transgender population in terms of youth. And need for community and school-based prevention programs, early identification, and limited access to firearms may be some ways that communities would be able to address this prevalence of suicide. I want to go back to this highest rate of suicide in the US, white men over the age of 75. Men are often have a more of a comfort level with things like weapons, such as guns. Thinking about a man over the age of 75, we may be talking about somebody who's recently retired. So they've had a significant change in their life in terms of routine and sort of self-identity. There may be issues around now being without their spouse because possibly maybe they found themselves as a widow. There may be distancing in terms of other relationships with their children, different kinds of things like that. So it's interesting that the statistics show that that is the population, but I think it's important for us to think about why is it happening with that particular population. And what the research says is that we're really taking a look at sort of these continual losses. If I'm not going to a job anymore, if I'm not a quote college instructor, then who am I if I take a lot of my value and self-worth from the job that I do? So if I don't have that job anymore, who am I? If I'm not so-and-so's wife or so-and-so's husband, I'm sorry, if I'm not so-and-so's husband anymore, then who am I? If I'm not so-and-so's father anymore, then who am I? And so those are those losses that men may experience. And for reasons that are not well explained, for some reason, in terms of ethnicity, white men over the age of 75 are at a higher degree of risk. So the impact of mental health status on the at-risk population, there are particular populations that have been identified as being at higher risk for experiencing mental health issues. Those include women, persons of color, the elderly, those who are poor, persons who are gay, lesbian, bisexual, or transgender, and those living in rural areas are at highest risk for experiencing mental health problems. Does it mean that others who don't fall in these categories don't experience mental health problems? No, it does not. It just means that if you take a look at the prevalence of mental health issues, you're going to find that more people that fall in these categories are experiencing mental health issues that lead to dysfunction as opposed to others. Members of marginalized groups, often isolated from mainstream society, who do not have access to resources such as food, clothing, shelter, employment, may be more at risk to have their mental health impacted by their circumstances than those in more positive circumstances. So it has a lot to do, goes back to what we've been talking about since day one, has a lot to do with the impact of living in poverty, a lack of shelter, a lack of clothing, a lack of food, not having that safe environment, Maslow's hierarchy of need. It goes back to all of those kinds of things. Um, Marginalized groups are much less likely to have access to needed services. So again, people of color, the elderly, LGBT folks, people in rural areas may not have access to the services that could help them in terms of dealing with a mental health issue. It's estimated that 3.7 million of US children, nearly 5%, have moderate or severe emotional or behavioral problems that are likely to interfere with their ability to learn and their relationship with families and peers. And we certainly do see that with autism. And then finally, a report, the America's Children Key National Indicators of Well-Being out of the National Institute of Mental Health, discuss the short and long-term implications of children's development and future if more attention is not paid to their needs when they are young. So the earlier that we can begin to identify and diagnose an individual child who may be at risk for mental health issues, the more likely we're going to be able to reduce the impact of that mental health condition to their lives and their ability to function. Going on with at-risk populations, we know that people who have survived disasters or trauma, persons who have experienced or observed trauma are likely to experience post-traumatic stress disorder. We know that in terms of people who have been in the military, people who have experienced, they actually talk about national or natural incidences. So things like, hurricanes and tornadoes and maybe even forest fires, might be somebody who may experience post-traumatic stress disorder. Persons who work with individuals exposed to trauma, so people like ER staff, first responders, police, firefighters are also subject to PTSD. Certainly victims of rape, folks who have been seriously injured, or witnessed the death of another person, people who have been in combat or natural disasters, as we said. PTSD is characterized by signs of intense fear, nightmares, flashbacks, problems sleeping, concentrating, eating, focusing on tasks, increased use of alcohol and drugs, and physiological symptoms. Sorry about that. As many as 30% of those who deploy to war zones experience PTSD, and many individuals do not seek treatment or support. Homeless persons, the release of individuals from mental illness, the facilities that we talked about at the beginning of the modular, people who experience developmental disabilities, chemical dependency, lack of community services, all of this results in a significant risk to these individuals becoming homeless. US Conference of Mayors reports some 26% of persons experiencing homelessness met the criteria of having serious mental illness. 40% of homeless individuals report problems with alcohol use, and 26 report problems with other drug use. Having no address can make it hard to secure services at times. The homeless are at risk for HIV and TB or tuberculosis, and some homeless develop mental illness after becoming homeless due to the stress of survival and the stigma of being homeless. So we are going to stop here, and when we come back, we will move into the third video and begin to talk about alcohol and substance misuse.